In today's video, I'm going to take you through a 20-minute strength and balance combination workout for your knee or hip osteoarthritis. Now, balance is something that there's often a deficit in when it comes to knee joint and hip joint pain, so we're going to make sure we include it in today's workout and practice it. We go for 30 seconds of work, 30 seconds of rest, and I'm going to have a timer in front of me here, which I'm going to start right now. And the first exercise that we're going to do is very easy, a sit to stand. So very much like a squat movement, you can have your hands out in front or hands across your chest, it's up to you, but off we go. So really brilliant exercise because it's functional and because you're using multiple joints at the same time. So with this, ankles moving, knees moving, hips moving, core's having to work hard. So a very time efficient exercise because you're getting lots out of it all in one go. Okay, perfect. 30 seconds of rest. Next exercise is going to be a balance. So we're going to alternate, bit of balance, bit of strength, bit of balance, bit of strength. So this one is going to be a side step. So you're going to step out to the side on one side and then the other side. So you're going to alternate between left and right. So this is challenging our balance and proprioception. Like I said at the beginning, it's something that there's often a deficit in if you have joint pain. So challenging our balance, make sure you feel safe. If you did want to hold on to something, you can. It's similar to strength balance exercise. You need to feel like it's stressing you a little bit. You need to feel like your balance is being stressed a little bit. So you might feel a bit unsteady, but you need to in order to feel a little bit of change, but you also need to feel safe. Good, well done. Okay, next exercise, strength exercise, is going to be for our calves, and we're going to do heel raises. So again, hold on if you need to. You're going to roll up onto your toes and slowly down. Roll up onto your toes and slowly down. So calves attach in behind the knee joint, so they are responsible for knee function. So it's important that we don't neglect our calf strength. So I'll show you a few to the side, slowly up, slowly down. From the back, you're trying to work through as much range as you possibly can. You really are aiming for trying to get right up onto your first and second toe if possible, to make sure that that calf is working through as much range as possible. Well done. So should feel a little bit of strain in the lower leg. Great work. Okay, fine. What is next? So back on the balance exercise, we're going to go on the right leg. You're going to, again, hold on if you need to, but you're going to do a tap out behind and then bring the leg up out in front. So right leg's going to be doing the work, if you like. Left leg is going to be doing the movement. So tap out behind, tap out in front. Hold on if you need to. 5. Off we go. So bring that knee up towards the chest and then back behind. Knee up towards the chest and then back behind. So it's the right leg that should feel challenged in terms of balance. And then what we're going to do is another strength exercise on the right side to really try and fatigue the leg. We're trying to cause some adaptation to the muscles. So we have to strain it, we have to stress it a little bit. So perfect. Great work. This time we're going to move on to a single leg squat on the same side. So you can pretty much stay in the same position, hold on, and this time you're going to do like a single leg dip down. Single leg dip down. So it's a toughie. Work through whatever range you feel comfortable with. So if you have got some soreness in the knee and you only want to do a very small one, that's absolutely fine. Just do whatever feels comfortable for you. What I can 100% guarantee you is that doing something is much better than doing nothing at all. So you just do whatever feels comfortable. Even if you wanted to do a dip and then put your foot flat on the floor so you could have a little rest, that's fine as well. So you could dip down, have a rest, come back up. If you want to challenge yourself a bit more, find that a bit too easy, then you just progress through more range as you feel comfortable. Well done. Brilliant. Okay, so the same 2 exercises this time on the other side. So this time it's the left that's going to do the work. So you're going to tap out behind, come up and out in front. Tap out behind, and then drive that knee up and out in front. So challenging the balance on the left leg this time. Same 2 exercises. We've got the tap out behind, and then we're going to do the single leg squat. All right? So off we go. Really concentrate. Try and keep your bum muscles nice and tense, core nice and tense. This is a balance exercise, so we're trying to stay as stable as possible. If you did need a little finger touch, you can do this in your kitchen. Just pop your fingers on the kitchen surface just for a little bit of stability, or back of a chair just for a bit of stability. Get yourself steady, and then you can carry on. Okay, so next exercise is going to be single leg squat, same as before. Leg out, opposite leg out in front. Going to tap, come back up. Tap, come back up. Enjoy your rest. You're halfway through your rest period. Whew. Getting puffed out. Okay. Single leg squat on the left. Hold on for support if you need to. So that's the difference between balance exercises and strength exercises. So when we are trying to strengthen something, we have to be stable. If we're not stable and you try and do a single leg squat without any balance, it's no longer a strength exercise, it's a combination of the two. So if we're purely working on strength, we need to be stable because we want to make sure we're loading ourselves enough. So if this was too easy, you could just add some weight, but I'd much prefer, if we're working on strength, you're stable, you load yourself enough. So if you find this easy, grab some weights, and then you can work on strength separately to balance. If you want to work on balance, you need to feel a bit off balance. Obviously you can't load yourself very much. If you're working on strength, you need to be stable so you can load yourself enough. Okay, next exercise is we're just going to go around it in a star or a compass if you like. So right leg is going to do the exercise first. You're going to tap out in front, tap out behind, tap out to the left, tap back behind. If I show you side on, tap out in front, tap out behind, tap out to the left, tap back behind. So like I say, obviously this is a balance exercise. If I was to start loading myself more with some weights, I just wouldn't be able to do it. Or I wouldn't be able to load myself very much. So balance, you want to challenge the balance. Strength, you want to challenge the strength. Perfect. Whew, that was tough. Now we're going to do another strength exercise, and then we're going to do the same exercise again on the left. So strength exercise is going to be a squat. So you're going to try and do squat, back down, squat, back down. So key things are chest up, bum back. So you don't want to bring your knees over your toes. If you've got sore knees, that is going to be more uncomfortable than sticking your bottom out and then come back up. So imagine there's a chair behind you. It's very similar to the movement that we did in terms of the sit to stand. Hips back. When you look down at the floor, you should be able to see your toes. If you can't see your toes, your knees have come a little bit too far forwards. Good work. Well done. Keep going. Nearly there. Great work. Oh, okay, right. Last balance exercise on the first round. So back to our little star balance exercise. So we're going to come, left leg is doing the work this time, out in front, back behind, out to the right, and then back behind. So similarly, side on, tap out in front, tap out behind, out to the left, out to the right. Now, this one, if you wanted to make this harder, you just go further away with each tap. And the tap is exactly that. It's not a step and rest. It is a touch, 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 touch. So that leg is not getting any rest in between each round. If you need to kind of set yourself after each one, that's fine. Get yourself steady, then you can try again. So that's the end of round one. Well done. Another round to go. Grabbing our chair back. If you don't have a chair, you just want to do another squat, you can do that. All right, but I'm going to take the opportunity to have a rest, I think. So, give your legs a little breather. And we're going for our sit to stand. All right, off we go. So you're going to drive through the knees, drive through the balls of the feet, drive through your hips, and you're going to push yourself up. Down, push yourself up. Great work, guys. Keep up the good work. Well done. Excellent. Again, if you found this one too easy, grab yourself a little bit of weight. You could hold that across your chest, and you could do it with your weight. Okay, well done. Getting rid of the chair. This time we're going to back to the side steps. So we're going to alternate between left and right within the same 30 seconds. So we're going out to the side, out to the side. We're going left and right, but enjoy your rest. Make the most of it. 10 seconds. Okay. So hopefully legs are feeling a bit warmer. Hopefully things are feeling a bit more loose. Okay, and we're going out to the side and then back to the middle. So this is our balance exercise. Good work. Keep it up. If you want to do a small one because your knee's a bit sore, that's fine. Again, this is no competition. You just do what you feel comfortable with. And then if you practice the video, if you found that the video is helpful, like it, that will keep it in your history. And then you can come back to it at another time. You practice, then you'll find you can probably go a little bit further as you progress through the frequency of how often you do it. So, next exercise, heel raises. Hold on if you need to, and we're going to roll up onto our toes, slowly back down. Up onto our toes, slowly back down. So nice and easy. With this one, again, if you found it a bit too easy first time, you can do 15 seconds on one leg. You can do 15 seconds on the other leg. So I'm going to do 2, but if you wanted to make it harder, you've doubled the amount of load going through that calf by doing it on one leg, and you'll find it much harder. So you're just going all the way up, all the way down on one if you wanted to, and then you'd alternate between left and right. So you might do 15 seconds on one, 15 seconds on the other. But great work. Keep it up. Well done. Excellent work. Okay, next exercise is our tap out behind and then driving the leg up out in front. So right leg is the one we're going to fatigue first. A little bit of support if you need to, but it was tapping out behind, driving that knee up and out in front. Tap out behind, driving that knee up and out in front. Okay, so challenging the balance this time on the right leg. All right, 5 seconds. Get yourself ready. And off we go. So drive that knee up like you're doing a kind of sprinting running time motion. If you feel like, again, things are a bit too sore to get up to 90 degrees at the knee and 90 degrees at the hip, you can just go to here. That's fine. All about comparing yourself to yourself. That's it. That's all that matters. And then you can use that to see if you progress over time. Good work. Well done. Brilliant. Okay, this time, single leg squat. So staying on the right leg, tiring out that right leg. Hopefully it's feeling a little bit achy, and you're just going to do a squat and then back up. Single leg squat, back up. Okay, get a breather. If you need a glass of water, pause the video for a second, grab yourself a glass of water, come back. And this one is going to be a strength exercise. So get yourself ready. And down we go. Up, down, down, up. So working on hip strength, knee strength. Another exercise where you're going to be moving multiple joints at the same time. So our joints very rarely move independently of each other when we're using the stairs, when we're getting out of a chair, when we're getting out of the car, when we're getting off the floor. our joints are moving together all of the time. So they're the exercises we want to focus on if we can. Good work. Last one. Okay. Shake it out because that is feeling tired now. And we're going to do our tap out behind, driving the knee up on the left side this time. So get your breath back. Hope you're finding this helpful. Hope you're feeling a bit warm. I certainly am. Okay, right, 5 seconds, going to get ready. Set yourself up if you need to. You're going to tap out behind, drive that right leg up. Tap out behind, drive that right leg up. And you're going to keep going for the 30 seconds. So working on a little bit of balance on that left side. If you do have soreness in one side over the other, these exercises will be a nice kind of marker for you in terms of comparing the affected side to the unaffected side and kind of working out how much of a discrepancy or a difference there is between the two. Beautiful. Okay, so have a breather. We're going to do the single leg squat on the left side, so the same side, which is this one. But don't go till you have to. All right, but this exercise is a good one, particularly if you find going downstairs difficult. So this is that sort of movement. So it's really tough going downstairs on one leg, obviously on one leg. We're going downstairs because you're taking all of your weight through that one leg and your knee and your hip are having to control that movement. So real typical sign if you've got hip or knee arthritis is that little crab side step down the stairs, because going down sideways is a little bit easier. You don't have to, the legs don't have to do as much work, which is fine if you're really, really sore for a week or two, you're having a flare up, but you probably want to try to avoid doing that for a prolonged period of time. Right, where are we now? We are going to do our little star balance exercise. So onto the right side, tapping out in front, tapping out behind, tapping out to the left, tapping back behind. Side on, tap out in front, tap out behind, tap out to the left, tap back behind. Okay, off we go. So you're going to touch, if you feel like you're losing your balance, like me, then squeeze your bum cheeks in, squeeze your tummy muscles in, gain that control, and then carry on. Well done. Really having to concentrate here. Great work. Okay, shake that out because that's definitely getting tired. Now we're going to move on to the squats. So once again, chest up, face up, bum out. Stick that bum out, okay? Have a look at your toes. You should be able to see your toes as you go down. So if your knees start disappearing, really try and imagine there's a chair behind you. You're going to stick your bottom in that chair, okay? Go. Well done. And again, range that feels comfortable for you. Doesn't really matter what you do with your hands. You can have them out here, you can have them here, doesn't really matter. If you find it too easy, like I said before, just grab yourself a little bit of weight. Great work, guys. Nearly done. Last exercise, which is going to be our star balance on the left side. So tapping out in front, tapping out behind, tapping out to the right, tapping back behind. So make the most of the rest. Last one, you know, a 20-minute workout. You should be really pleased with yourself. Bit of strength, bit of balance. Both of which are very important if you have joint pain, if you want to try and see improvement in your joint pain. If you found it helpful, share with your friends, share with your family. If you think they've got joint pain or if you have got joint pain. want to try and get as many people moving, mobile, and a bit more pain-free as possible. Okay, well done. That's it. I hope you found it helpful. If you did find it helpful, you liked the video, then like it, just down there. Click the button and subscribe if you have not already. I release weekly workouts or education videos on all things joint pain. So if you subscribe, you won't miss any of them. Whilst you're doing that, I will see you in the next one.